Good morning, Facebook. I am Megan Rogers, volunteer supervisor in the Northwest region of Indiana for SHIP, the State Health Insurance Program. And I am joined by my lovely co-host, Susan Spilly, in Indianapolis, in central Indiana. And we have a special guest with us this morning, Hollie Hess, who is the Dementia Outreach Specialist with CICOA, one of the area agencies on aging in Indianapolis. And she has a very special presentation for us. She is going to educate us on the dementia services with their area agency on aging and explain what their program does and probably a little bit about what the other area agencies on aging do or have programs like theirs throughout the state. So good morning, Hollie. Thank you for joining us this morning. Before I turn it over to Hollie, I will remind everyone that if you have questions as we go along, please chat those in the chat box, and Susan and I will be watching for those. So Hollie, I am going to turn it over to you now.
All right, good morning, everyone. Let me share my screen here. I'll go to presenter mode. All right. So, like Megan said, my name is Hollie Hess, and I am the Dementia Outreach Specialist for CICOA. And before I get into all of our dementia programs, I just want to introduce myself and my background, and then also talk about CICOA as a whole. So, my background, I came to CICOA about 3 years ago, and before I was in this role, I actually served as a CNA. So while I was getting my master's and bachelor's degrees in healthcare management, I worked as a CNA in long-term care and in home health. So I got a lot of hands-on experience working with people living with dementia. So it's been such a blessing to be in this role at CICOA where I get to impact them in a different way. And I also have my certified dementia practitioner license that I got last year. So I am very well versed in dementia, but there may be a question that comes up that I actually don't know how to answer. And I'm going to say, that's a great question. I'll get back to you on that because dementia is very complex and there's a lot to it. So yeah, that's myself there. And like Megan mentioned, I'm the Dementia Outreach Specialist for the area. So each area agency on aging has a dementia outreach specialist. So you can see there on my map of Indiana, if you're in a different county, not in Area 8, you have a different dementia outreach specialist. So that person can come to outreach events. They can speak at different things like I am right now. And they can just give you education and resources. So please utilize that role if you need to. And if you're in Area 8, hey, it's me. I'm your dementia outreach specialist. So reach out to me if you have any questions or need anything. But CICOA, like mentioned, is the area agency on aging that serves Marion County and the surrounding donut counties. So we're in Area 8. We're a non-for-profit. We were founded in 1974, so we just celebrated 50 years. And like I mentioned, we're serving Marion County and the surrounding donut counties. And again, we serve older folks, people with any disability, and their family care partners. So we really just want them to be able to be independent, have great quality of life. So we are supporting all of those people in our community. And we do lots of different services at CICOA. So, and if you're not in our area, Agency on Aging, your area does some sort of versions of these. So here at CICOA, we start with our Aging and Disability Resource Center for any questions and things like that. And then, we have these different service lines like our case management. We have caregiver support. So if you just the person that is the caregiver, as long as they live in our service area, they can qualify for that. The person that they're taking care of does not necessarily need to be in our area. We're doing meal services, transportation, lots of good stuff. So I'm not going to go too far into all the other CICOA services, but if you have a question about that, feel free to check out our website. It's just cicoa.org. We've got a lot of resources, and if you want to refer to one of these programs, you can do that online. And also our office is open Monday through Friday, 8 to 5 p.m. So if you want to walk in and ask questions too, you totally can. But I am going to focus on our dementia programs today. So At the moment, I'm currently a one-woman show running these dementia programs, but we will have another coordinator helping with that. And then I have a wonderful director that I'm now under. So anything CICOA dementia programs related, I'm your gal. So reach out to me with any questions. But yeah, I'm really excited to share this information with you all about these two programs that we do here. So, CICOA started with Dementia Friends Indiana in 2017. So, CICOA is the state license holder for Dementia Friends Indiana, but this is a statewide initiative. So, we have champions across the state that deliver these Dementia Friends sessions. So, in each area, there are a few champions that can give these sessions to you. So, all Dementia Friends Indiana is our 60-minute information sessions. So we give these all across the state. We give them to all sorts of different groups. So you can see here like students, seniors, professionals, anybody can go through this 60-minute information session and really learn what dementia is, what are the signs and symptoms, what are good patient strategies that you can really dementia to someone. Stigma surrounding people living with dementia. Like I was just sharing with someone a few days ago, when someone gets cancer or diabetes, they're uplifted in the community and they're supported. But when people get the dementia diagnosis, there's a lot of stigma and isolation and like fear. So trying to fight that and educate the community so they can lift others up as we do when someone gets a cancer diagnosis or something like that, right? So we do private sessions, we do public sessions, so you can check out our website if you want to attend a public session. And you can also, there's a contact form. So if you want to request a session for your organization, we can even do it with like a family too. It can be really small and intimate, or it can be big and public. It can look however. And we have champions all across the state that can do these. So email me if you want to schedule a session. Reach out to our contact form on our website if you want to attend one. But yeah, really, again, we're educating, we're giving awareness, and we're reducing stigma. Yes, Susan?
Holly, there's a question that's been texted to me. What is the charge to have one of these 60-second sessions?
0. It is totally free. Yeah, so everything I'm going to share right now is all totally free for anybody to get involved in. So great question, Susan. So yeah, if you want to schedule a dementia friend session, reach out to us via website, via email, and we're happy to do that. And again, this is statewide, so you can get into this anywhere in Indiana. Okay, and then when I came on full time, as I came on as an intern for CICOA, I started our Dementia Friendly Indianapolis initiative, and I have been so blessed to continue on full time to be able to grow that initiative. So they're two separate initiatives, and I know they're very similarly named, and I apologize for that. Do not blame me though, because I didn't, it's not all my fault, but I want you guys to be clear on what these two different initiatives are. So I have a little chart here that shows kind of the initiative. So Dementia Friendly America is the big organization that's administered by US Aging, and they oversee the Dementia Friends part, but also Dementia Friendly Communities. So these are two separate initiatives, and how I like to kind of explain it, you can see here, doing Dementia Friend sessions is an activity of a dementia friendly community. So I'll go back, don't worry. But so there's different dementia friendly communities across Indiana. So this is something that a community applies for through Dementia Friendly America and gets designated as. So there are lots of different dementia friendly communities, and Indianapolis is just one of those communities. So just to make it clear what I oversee, CICOA is the state administrator for Dementia Friends statewide, but we're just one of the communities in the community network, okay? So there are lots of communities. So Bloomington was the first community, and they started about 2017 as well. And Amanda Porta with IU Health oversees all the communities, getting them set up and having those around. So again, this is something that we applied for. We had to get letters of support from the community, and we had to assemble a cross-sector action team. So with Indianapolis, we got designated in January of 2023, and really the community can do whatever the community needs. So there are example activities that Dementia Friendly America will give you. but you do what your community needs here. So that's up to the action team that decides it. So really, this is a great initiative to bring together community and identify gaps and serve those. And, in turn, and creating a welcoming environment too, networking and knowing what other services and supports are out there in your community helps create that welcoming environment. So that's why we bring everybody together for this cross-sector action team. So yeah, you can see the different ones happening in the state. And you can start one. You do not have to be me to start one. Anybody can start this dementia friendly community, and we would walk you through kind of the steps to do that. But you really lean on your action team to help guide what the team does, right? So again, the difference between Dementia Friends and the community initiative, right? Dementia Friends is just those 60-minute information sessions. The Dementia Friendly Community Network is a whole different beast, and Dementia Friend sessions can be an activity of a dementia friendly community. That makes sense there. So for Indianapolis, our mission statement that we came up with is creating a welcoming environment for those living with dementia and their care partners through care. So we do different community events in the area. We do awareness and resources through our new website. We had a wonderful intern that's been working on the website for us. So that is now live. And we do different education, like with Dementia Friends sessions, right? And we have a very large action team that oversees this. So we have people living with dementia on the team. We have care partners on the team. And then we have lots of different organizations, not just healthcare, but all sorts. So like we have UIndy who's involved. We have like a radio station that's involved. So anybody who's just passionate about creating this welcoming environment is welcome to join the action team. And so you can see here, this is kind of our flow chart of what we worked on for 2025. So just to kind of show, those different bins and what activities we actually did from them. So, and I'll explain some of these stuff further, but this is the different things that we're working on in the community. We're doing a spring and fall festival every year that, yes, it's a resource fair, but it's supposed to be really fun. So all the vendors bring an activity or some sort with them, so it can be an interactive thing. We just had a state conference a few weeks ago up in Fishers, Indiana, where all the communities came together to learn and grow. So that was a really awesome conference, and we'll continue to do those down the years. And memory cafes, which I'll, explain a little bit later. But yeah, so we're doing lots of different things. And again, these are things that the action team felt like we needed. So it's not like I'm just saying, hey, we need to do this and this, because I don't know what's best for the community. The community knows what's best. So memory cafes, just to explain what that is, this is a concept, excuse me. It's just a social gathering for people living with dementia or any cognitive change, so mild cognitive impairment, just anybody who really wants to come and feel supported, right? Any type of brain change that's happening. You leave your diagnosis at the door and you come and have fun. Everyone there has an understanding of why they're there, but it's really to create that community support and have fun. So we try to implement these not only in our service area, but all across the state. So our Dementia Friends Indiana website stays updated with what memory cafes are going on across the state so that everybody can be able to utilize them. So this can also be used by home health aides and formal or informal care partners. So if you're a formal care partner and you're taking care of someone and they're always at the home and you're not sure what to do with them, memory cafes are a great opportunity and resource for you. Same with informal care partners, because it allows the care partner, now it's not respite and it's not something where it's like a side by side to where they get separated. It's where the care partner can kind of take a step back and just be the loved one or just be the friend, whatever that role is, instead of being the care partner in that moment. So lots of different activities can occur at the memory cafe. You can make it what you want it to be. So some examples here, like, during this, holidays, we'll do holiday related activities that you can see here. So Centerwell Senior Primary Care is a senior primary care office that exclusively takes care of seniors. So they have a wonderful activity center there, and we do memory cafes there monthly here in Indianapolis. So that's something, you can replicate and do anywhere, right? It doesn't have to be in a certain place. And again, it doesn't have to look a certain way. So like we've done a drum circle. We do all sorts of activities with this. Really, the goal is fun and community support. So like I mentioned, the website dementiafriendsindiana.org has our memory cafes statewide. Also, our Dementia Friendly Indianapolis website has Central Indiana events. So, Dementia Friends Indiana will always have everything statewide. Dementia Friendly Indianapolis will focus on just the events in our area. But if you're anywhere in the state, check out our website because we have lots of good events that we share so that people know about them. Okay. Another thing that we do at Dementia Friendly Indianapolis is a Living Well with Dementia event series. So you can kind of infer someone living well with dementia speaks to the group about how they're living well, and their care partner talks as well. So we've done this 8 different times across the Indianapolis service area. So we actually started doing this because one of the people living with dementia on the action team was asked to speak at a senior service place. So that's why we created this event. So it really just requires like a partnering organization to host, someone living with dementia to speak. So I coordinate that, and then myself, and then someone from the Alzheimer's Association speaks as well. So we work with them, we're partnered up with them, and so we're happy to support in that way. So um, if we do have any Living Well with Dementia events, we keep them updated on the calendar. If you'd like to host your own Living Well with Dementia event, you can let us know that, right? And even if you're not in our service area, I could connect you with the Dementia Outreach Specialist that's in your area and get you connected that way. If you could do, they could do some sort of event like this for you. So keep that in mind. And then the last thing I think I'll share here is our dementia friendly business training. So, this is something that IU Health developed, and each state kind of has their own version of this business training. So, this is totally separate from Dementia Friends. This is a certification that a business or organization can get as a dementia friendly location. So, 50% of staff go through the hour-and-a-half training where we talk about what is dementia and the basics, but also how you make your physical environment dementia friendly with like noise, signage, bathrooms, all of that good stuff. And the training can be done in person, online, or there's even an asynchronous module that people can complete on their own. So this is just another way that we're educating our community. So yeah, I think that is all that I have for us. So just to summarize, I'm part of CICOA. CICOA does a lot of different services and supports for the area, but I work with our dementia program specifically. So Dementia Friends is our education sessions. That's all that is. If you want to attend one, request one, check out our website. Dementia Friendly Indianapolis is part of our Dementia Friendly Community Initiative. So we're just one of the communities, and we do whatever our community and our action team thinks that we need to do. So for our action team, we meet monthly, but it can look any sort of way in a different community. And if you're interested in starting one or getting connected with an existing one, also reach out to us because I'd be happy to connect that for you. But yeah, I think that's where I'm going to leave off. Again, our websites, Dementia Friends Indiana and dfindy.org, have lots of good resources too and information. So if you're a care partner, if you're living with the diagnosis, we have specific bins of resources for you. So I highly encourage you to check out our websites if you want more information. So thanks so much.
Thank you, Holly. That was terrific. And I will admit that Dementia Friendly Indianapolis, Dementia Friends of Indiana, it is now clear about the distinction of those two
Good.
programs. So this has really helped me. I hope it's helped our viewers. And you can always, folks out there watching us live, these are recorded and they are posted on our YouTube channel and will be held on our Facebook page. So if you know somebody who might be interested in any of these programs and services, especially that memory cafe, if you're a care provider, um, you know, you can share this with them and they can watch this video and they'll know the differences and what they might be most interested in and be able to contact Holly for more information.
Mhm.
And Holly, if someone does live in a different service area, so they have a different area agency on aging, where do they go to find their area agency on aging?
I believe there is an Indiana Area Agencies on Aging website. I think it's called like IAAA.org.
Hmm.
But I mean, even if I'm sure if you just look that up, something will pop up to show the breakdown. But if someone has any questions about what area they're in, I'm happy to assist in that way too. But I think that's the
Terrific.
website.
Yeah, well, we can put that website in our chat,
Okay.
IAAA.org.
Yeah.
So, and that they'll, I think there's a query on there. You could probably just put your county in and get connected. So,
Yeah.
Megan, did you have any questions that came to you?
I do not. I just thank you, Holly, for the work that you do, the presentation you gave. I'm a caregiver for my father who has dementia, and every day is a new day. And I think I've got it figured out after 9 years, and he goes down a completely different path. And Susan knows a little bit about this, so that's why she's smiling. So if you're a caregiver or even the person with dementia, reach out to your support people, reach out to these dementia friendly people because you need that support. You may not think you do, but you do. So just thank you, Holly, for everything you shared today.
Of course. Thanks for having me.
Yeah.
Holly, if you take down the slides you have up, I can get the
Got it.
calendar ready for Susan. Thank you.
Yeah, so we're going to share with you our calendar for the month of June. Can't believe it's June. I don't know what happened to May. Although something wonderful happened in May and the Pacers beat the Knicks and now we're in the NBA Finals. So we'll get that up and then we'll review what's coming up this month for our
There you
Facebook
go.
Lives. There we go. Okay, so on the 11th, What to Know Wednesday, we're going to have coffee and conversation with an Indiana folks at our Indiana ship site. And Megan is going to be doing that one with one of her ship sites up in northern Indiana. So tune in and find out what all services you can get from ship sites and talk to some counselors and get some information and questions answered. Then quickly after that, we have another Medicare Monday, and we are going to try something interactive and fun. Who does not like bingo? Everybody likes bingo. Who doesn't like winning prizes? Everybody likes winning prizes. Well, you can do both of those things with us on Medicare Monday on June 16th. So we will get you bingo cards and you can play along at home and learn a little bit about Medicare along the way. So do check us out for that one. That's really going to be very fun. And then to wind up the month, we are going to have our cohorts from the Indiana Department of Insurance, where Indiana SHIP is housed in the state, and Jennifer Groff, who is the communications director, I think that's her title, of the Department of Insurance, because you don't know what you don't know. So you got to find out all of the things, all of the services you can receive from our Indiana Department of Insurance. Heck, we're paying taxes. Let's find out about that department and what all they do and what services they can provide for us. Insurance, no matter what kind, is a complicated thing. And after you listen to Jennifer, you'll know where to go for help, where to go to file grievances, and all that kind of good stuff. So join us at the end of the month on June 30th to hear Jennifer and come with your questions. So that wraps it up for today. Thank you all for taking a few minutes of your day and learning about the dementia friendly programs that we have here in Indiana. Thanks again to Hollie Hess from CICOA joining us this morning, and have a terrific day.